Vulnerable populations. Dr. Robinson. Social Work 125. How social work delivers services in micropractice. At this level, social workers help people to function better in society, and in turn, help make society work better for the person. Macro practice usually involves direct intervention on a case-by-case basis or in a clinical setting. It is the most common level practice, which involves working with individuals and families and small groups to function better in larger environments. At this level, you work directly with an individual, working from a strength perspective. A social worker must develop an empathetic relationship with an individual by going through a process of engagement and preparation, followed by assessment and contracting, then going to intervention, evaluating, terminating, and then following up services with clients. The issues that vulnerable populations may experience at this level. Locally, there may not be adequate resources such as libraries, employment centers, and funding affects all three areas: local, regional, and national. On a global scale, the United States is seen by many countries as not providing adequately for its citizens. Menzo activities include facilitating communication, mediation, and negotiations, educating and bringing people together. Menzo social work involves the development and implementation of social service initiatives at the local and small community levels: schools, neighborhoods, city districts, etc. Menzo social work practitioners tend to interact directly with people they wish to assist. However, instead of engaging in individual counseling and support, Menzo social workers administer help to groups of people at a time. Examples of projects that Menzo social workers could be involved in include the establishment of a free clinic to help serve the underserved members of a community, county health programs to help disadvantaged families learn how to attain proper nutrition, workshops to guide the unemployed individuals through the process of applying for jobs and unemployment are all examples of Menzo social work. Menzo social work is often a secondary practice that micro-social workers engage in to help their clients' population on a slightly larger scale. For example, school social workers who work closely with students may practice Menzo social work when they develop and host presentations on students' issues such as bullying or substance abuse. Menzo is often uses both micro and macro levels to achieve their goals, using small groups to create change. Once again, funding at all four levels is an issue that vulnerable populations must face. Also, lack of interest by the larger community will impact these individuals. Macro social work involves changing the environment so that it works better for the individual, and may include becoming involved in political action, community organization, public education campaigning, and serve as administrators or intervene in communities and the legislative arena to affect social change. If at the local level the vulnerable populations are not politically active, registered to vote, legislators are likely to be less interested in their issues. At a regional level, impoverished communities create blight for the whole region. If at-risk populations are not politically active, they are not being represented at national level nor global.